Today I'm going to show you how we use the Webster technique to adjust pregnant moms. The first thing that we do is we check the entire spine. We do this because although we're concerned about aches and pains during pregnancy, when we think of the spine, we actually want to think about what the spine protects, and that is the central nervous system, the brain, and the spinal cord. So we want to make sure that the messages are getting communicated properly from the brain to the spinal cord, out to the spinal nerves, and back up to the brain. Because not only is mom going through so many changes during pregnancy, but baby is growing and developing as well. Now onto the Webster technique, which focuses on the pelvis. So the first thing that we want to do is check the sacrum and see if there's any restriction there. So that's what I'm doing when I'm bending the knees. I want to see if one side feels more resistance than the other side, and that's going to give me some information if this tailbone is restricted, which is something that we don't want to be happening during pregnancy or especially during labor and delivery. So I'm adjusting that here with the integrator, which is an adjusting instrument that I use a lot with pregnant moms. The video only shows this briefly, but I'm releasing the sacrotuberous ligament, which goes from the tailbone to the pelvis, and if that gets tight, it can restrict the sacrum, and it also, when stimulated, helps to promote the parasympathetic part of the nervous system, which is for rest, digest, relaxing, and healing, which is super important during pregnancy and labor as well. The next thing I'm doing is checking the piriformis muscles, which tend to get tight, as well as the coccyx and pubic symphysis. This mom didn't need her pubic symphysis adjusted, but if she had, I would have done that when she turned over here. What I'm doing now is checking the round ligament. So if you think of the pelvis and the uterus like a hot air balloon in a basket, the ligaments are going to be the tethers that attach the balloon to the basket. So if they get tight on one side, it can cause the uterus to be a little bit lopsided, which can restrict movement of the baby and affect their ability to get into the optimal position. So relaxing that ligament helps to make sure that that doesn't happen. The next thing I'm doing here is checking the psoas muscle, which is a muscle deep in the hip, flexes the hip, and it can be related to some hip pain and low back pain. And this often gets tight because the center of gravity is changing during pregnancy.